And thank you so much for coming. I'm glad that you were able to make it and had some interest in what we've been able to plan today. Of course, I want to thank Jim Cantwell, who arranged for this, and I'm so grateful for that, as well as Patrick O'Connor, which is so nice to have you too. Jim's dedication and energy and ideas for promoting the needs of our seniors, both on the Hill and here in our community, are just fantastic, and I can't thank him enough for all he does, and really appreciate that. We have our own special concerns here, as we all know, as far as hoping to find a location and build a new senior center, but we are really so grateful that we are funded at the state level in many ways, really. So we have our transportation services funded through GATRA, Regional Transportation Agency. We get our annual formula grant through the Executive Office of Elder Affairs, which has gone up this year thanks to our legislators and everyone advocating for us. We have grant opportunities and services provided through Social Elder Services, which is our area agency on aging, and as well Mass Council on Aging and Social Community Action Council. So we do have good support from various state agencies that we can be thankful for and proud of. I do want to thank so much both Ann Bonner, who is here from the Executive Office of Elder Affairs. She is the Secretary of the Executive Office, so thanks so much for coming. And also our representatives from the Attorney General's Office, who are here courtesy of Marconi. Marconi, who is the Community Engagement Director of Community Engagement. So Tim and Allie are here representing him today. So thank you again so much. I'm going to turn it over to Jim for a couple of words.
And Patrick and I, we do a tag team for things to show the bipartisanship. Thank you for everyone coming out. One of the greatest aspects of my job is being able to come, in both of our jobs, getting able to come and being able to learn from folks to know about what everyone's priorities are. And I would say, Linda, for your advocacy, because it is true for this year, we have tough grant times and tough budget times. And we just knew from this last time you were looking at a reduction for formula grants. Pat and I worked together to make sure that we increased the funding by a little over about 11% this year, which helps us just for some of the day-to-day activities. I am thrilled that we worked to make sure that GATRA came. For your predecessor, Florence, Joe and I have been talking for so long about transportation issues, making sure that came together. But the other part is just bringing experts to come down to talk to each and every one of us. So I want to make sure that Pat will have both of us speaking from here, but we just were talking, and we know that one issue for all seniors in town, a long process of making sure to get adequate facilities here. So Alice was expecting that we may chat about that a little bit later on. But what I'll leave you with is to tell you how we are all of us, by having the adequate facilities, we're going to extend each of our lives. And I can tell you one person that's extending his life is Emmett Schmarzo, who I worked for him when I was 16 years of age, and he is still running things at Elder Affairs. So please tell him that we extend our blessings and our thanks. And we'll talk at the very end just to do a thank you for the representatives from the Attorney General's Office and Commissioner for yourself for coming down. So let me turn it over to Pat, and then we'll have you speak.
Sure. Great. Well, thank you, Secretary, for coming down. Thank you, Representative Cantwell. Thank you to the entire Senior Center here in Scituate. I'm new to the State Senate. I've only been in office 5 months as of yesterday, but I'm very familiar with the needs and concerns of the senior population, both here and throughout the South Shore. As Jim touched on very briefly, we were able to secure an extra $1 for every senior citizen for our senior centers for every one of our communities, which was something that Jim and I fought real hard for, because we know how important these programs are and how important, as Jim had mentioned too, new facilities are. So we understand it, we hear the concerns, and we're up there fighting for every dollar that we can. It is tough budget times. If you've seen in the newspapers, the governor's offering some early retirements, and during this budget process, we had to tighten the belt a little bit, but we're hopeful for continued economic progress, and hopefully that translates to being able to make some investments into new facilities and things like that. But as far as what we've been able to dealing with senior citizens on the healthcare issues, because healthcare is just incredibly confusing nowadays with everything that went on with the Affordable Care Act and how we've had universal health care here in Massachusetts since Governor Romney, and there are a lot of moving parts as far as healthcare goes. So please use us as your resource. If you ever have any questions with anything that you're facing, whether it be here an issue in Scituate or something that you have an opinion on that we're facing up on Beacon Hill, an issue, or if you have a problem that you need help with, please use us as a resource. Let us know how we can help. We're here for you. We work for you. So thank you for the opportunity to be here, and I'm looking forward to hearing some good conversation.
Madam Secretary, it's a great pleasure to have you come. I know for cabinet levels, I know how busy your schedule is. We're thrilled for you to come down and to make sure to present. And then what I think would make sense is for your presentation, and then take some questions, and then
Absolutely.
that presentation thereafter about ways to keep people safe and to avoid scams. So Secretary,
Great.
please take it away.
Thank you very much.
Thank you so much.
I'm delighted to be here today, and my name is Alice Bonner. I've been in my role as Secretary of Elder Affairs for a little over a year. Most of my career, I'm a nurse, and most of my career I've worked with older adults in the community, in nursing homes, in PACE programs, and as a nurse and then as a nurse practitioner, have a real sense of the complexities in healthcare. So I'm really glad that you mentioned healthcare as one of the issues that we can hear from you about and hear what we can do to do a better job. I would just also echo that we are here for you all, and we need to hear your voice as seniors and the issues that are facing you, because there's lots of important stuff going on, right? We've got the opioid crisis. We've got issues with the MBTA. We've got schools and road repair and lots of things that we all care about. But we need you and your voice to be talking about the unique issues that seniors are facing, because we're competing with all those other things. And for me to do my job, for your legislators to do their job, we need to be able to tell your stories. We need to be able to tell people about the challenges and the opportunities that you have as well in a community like this and what you want to see happen. So we can definitely talk about, communities that have built a new senior center and what it took and the perseverance over time, because my travels around the state have led me to a number of really nice new senior centers, and almost in every case, people have said it took us 10 years, it took us 12 years. It's not something that happens really quickly, but it's that perseverance and coming together as a community to enable that to happen that's important. So if we were to talk about healthcare for a moment, because at Elder Affairs, our mission is to promote the independence, empowerment, and well-being of older adults, people with disabilities, and caregivers. Many people here, you may be a caregiver for somebody at home or somebody else in your life. But our vision is that older adults and people with disabilities will have access to the information that they need to live well and thrive in every community. Accessing information has become very complicated because we can all go on the internet, and very quickly you will have a huge headache and be completely overwhelmed. And we hear this a lot. And it's not from seniors, it's from everybody. It's overwhelming. And you can get information, but you don't always know how to parse it and find what you really need. I need help, 3 days a week in my home with, bathing or grocery shopping or something like that. How do I Google that and get the right information for how I find those services here in Scituate? So what we have in Massachusetts, and somebody mentioned South Shore Elder Services, which is the ASAP, the Aging Service Access Point. Elder Affairs oversees all of the 26 Aging Service Access Points, the Elder Services organizations. So every single region has one of those organizations, and only one. And they contract with home health agencies, and they contract with other providers who would come into your home and provide services and things like that. So it's important to know that South Shore Elder Services works with your Council on Aging, works with Linda, works with the legislators to hear from people in the community and to, through information and referral, get you to the right people who can say, oh, you qualify for the home care program, the state home care program, based on your income, based on your individual needs, and so here's how to get in touch with the people in that program. It's possible if you qualify for Medicaid or Mass Health that you might qualify to be in the frail elder waiver. That's for people who are nursing home level of care but want to stay in their home or stay in the community. So that's a very specific program as an example. federally funded, and volunteers. Are there any Shine counselors here?
We have an amazing Shine volunteer, one.
You have one. Okay, well, treat them really well because they're like gold.
We tend to replace them.
Yes, okay. So we hear those stories a lot. So a Shine volunteer has hours and hours and hours of specialized training around health insurance. All the day. You know, right now it's open enrollment for Medicare, right? So you're getting all those mailings every day, probably multiple ones. You know, sign up for this plan, sign up for that plan. The Shine counselors have the detailed training to be able to help you think through all those options and what you actually do qualify for and how to make those decisions. And it's I think one of the, greatest programs that we have in Massachusetts, and there's well over 400 Shine volunteers across the state, and it's almost all volunteer. So we have a couple of people up at Elder Affairs who oversee the training and the program, but in your community, it is folks like you who decide to go through the training and then, help your peers. The other program related to health care is Prescription Advantage, which is an insurance plan for drug coverage for expensive prescription drugs. And as Medicare Part D picks up more and more of the cost, Prescription Advantage has become a smaller program over time because now Medicare covers things that they didn't used to cover. But there are still people who are lower income, older adults who may be on expensive medications that Medicare Part D does not cover. And so our Prescription Advantage program in Massachusetts helps older adults pay for those medications. So we have Prescription Advantage counselors and people at Elder Affairs who can talk you through whether or not you would qualify, the medications you're on, etc. So I would say that we are working really hard on this healthcare issue to also encourage in every community that your local hospitals, your local physicians and nurse practitioners and physician groups are working together with your Council on Aging, your Aging Service Access Point, South Shore Elder Services, so that there's continuity if you do go into the hospital and then you go back home again. People are thinking about things like, do you have food in your house when you leave the hospital? I was a nurse practitioner. I wrote lots of prescriptions in my time. I didn't always ask if there was food in somebody's house, and now I know because of my current job that's an important question. Do you have a ride to your doctor's appointment? Do you even have your appointment scheduled? All those little details. So we have case managers at South Shore Elder Services who can help with that, but we're also working so that before you leave the hospital, people there are thinking about what you might need in the community. Do you need medical equipment? Do you need a hospital bed? There's some things like that we usually, sort of cover. But we're learning more and more about what we call social determinants of health. That means, are you living in a safe building? Do you, if you have asthma or COPD and you need an air conditioner, is that something we ought to make sure you have because it's going to affect your health? Even though it's not a drug, it might be something that would make a difference. So those are some thoughts about healthcare. The other thing I would say that I hear about a lot, and again, I go everywhere, out to the Berkshires, down the Cape, North Shore, South Shore, Worcester area. We've really been across the state. Almost everywhere people talk about affordable, accessible housing and, have concerns either about themselves or about a friend or a neighbor. And, what we see is we haven't saved as much for retirement as we need. And that's really across the board. But Massachusetts, I don't know if there was a recent report that came out that looks at something called the Elder Economic Index. And it's a UMass Boston study that they do periodically. And it basically shows the amount of money you need to live in a state like Massachusetts that's very expensive compared to the amount that the average senior has. And we are second to last. Only Mississippi has a worse index than we do. So it doesn't mean that we're poor. It means that our cost of living is so high that no matter how much money we have, it's not enough. And the driver of that disparity is actually housing and healthcare costs. So we have some work to do around that. But affordable, accessible housing is something we talk about a lot with legislators, and I know, in this area to think about what is the income level of seniors in Scituate. What do you have available for different housing, either local housing authority that's public housing, maybe there's some private low income housing or lower income affordable housing, and maybe there's some assisted livings. So, what do we put together so that anyone living in Scituate as they get older can stay in Scituate? Because, and I don't know if some of you are from surrounding towns, but this whole concept of aging in place is really about people being able to stay in their neighborhoods, in their communities. Even if you change your house, you want to know that pharmacist. You want to know where you get your hair done. You want to know the grocery, the guy at the fish market. You don't want to change all those things and have to move somewhere else. So at Elder Affairs, we're very committed to working with our colleagues in the legislature, and Secretary Sutters and the governor are very committed to this issue of aging in your community and how we can really promote that. So I don't want to take up too much more time. We are working on lots of things around dementia, and you may have friends or neighbors or folks in your family who are suffering from Alzheimer's disease or dementia, and we have a number of communities that are becoming dementia friendly, and that means the community comes together, they talk about training programs for first responders, police, fire, EMTs, and there's a whole program to make a community responsive and to get away from the stigma of Alzheimer's and dementia in restaurants and hotels and parks and recreation activities and so forth. So if you're interested, I don't know if Scituate's on board with this, but we can certainly share the opportunity there. I'd be happy to, again, hear about your thoughts on, your vision for a new senior center and how Elder Affairs could help. But I think I'll stop there if that's okay. Is there anything else specific that you wanted me to touch on?
No, that was. I've been taking notes as you speak. That was.
I
used
talk
to
fast.
work.
I hope you write fast.
I do write
Okay.
fast. I talk faster.
You can also take one of these ones. It's got everything on.
I did. I took that.
So what would you all? Why did you guys come here? The 8 of you that came here, what did you come to hear about that I didn't talk about? I'd be happy to talk about anything else. We have lots and lots of programs, too many to cover in 10 or 15 minutes.
And what are the paths to go through? And I think that of all the things that you talked about this morning, that was really, I think, most important, because I can live in my own home but the services that are available and what services, some of them, in looking for a service not long ago, I found so many that I didn't even know existed. And even though I don't necessarily need them at this point, they're out there. And it's a very reassuring feeling.
That's good. And also, as even though right now you're able to be independent and live on your own, I think people think down the line, and I hear people who are worried about what if 5 years from now or 10 years from now I do need some help. And that's why it's good to plan ahead. And it's good, even if you don't need anything right now, to contact Linda and sort of talk through things, or with the Shine counselor or with South Shore, to hear about what is available. As you said, you have some comfort knowing if you do need something, here's what's out there. And again, it might be in the beginning you end up paying a co-payment, as you would with an insurance plan. But then as your resources diminish, then there are these other options with Mass Health, or we have a program called Senior Care Options. So that's an insurance plan if you have Medicare and Medicaid, or the PACE program, again, if you have Medicare and Medicaid. But these are very comprehensive, integrated programs where you get case management, you get somebody to help kind of talk through all these complexities. And so for people who feel that the healthcare system is overwhelming, an integrated care plan is really a good way to go. But again, that's for people who are on Mass Health. But there's scope programs also through like Tufts and Fallon and other private insurers as well.